Well, in today's In Sickness and in Health segment, we're going to spend some time discussing stroke symptoms and causes.
Yeah, sometimes the stroke happens gradually, but you're likely to have a few symptoms that you can be alerted by. You or a family member can notice them. We wanted to know more. Talking today with neurologist Dr. Jason Viereck. Thank you so much for being with us on Living808. We're talking today about stroke. And a lot of people may not know exactly what stroke is, so for our viewers, would you mind defining what a stroke is for us?
So a stroke is when there's an interruption to blood flow in part of the brain, usually because of a clot. That part of the brain will suffer and people can have symptoms from it. If you think someone is having a stroke, you should call 911. We have treatments for stroke, very effective treatments, but they have to be done quickly. Just call 911.
What does it take to care for a patient at Adventist Health Castle that has suffered a stroke?
Castle is now nationally certified as a primary stroke center. We have a whole team in place to meet patients when they come in who've had a stroke. The accepted treatment for stroke is this clot-busting drug. Besides that, we have specially trained nursing staff and ancillary staff that helps care for patients throughout their stay in the hospital. Patients need to be seen by physical therapy. They may have trouble swallowing. They may need special medical care. They're at risk for pneumonia and other complications. And a primary stroke center has all of the pieces in place to deal with all of that.
What are some of the signs? If you're looking at somebody, what are some of the signs of someone actually going through a stroke?
The symptoms of a stroke and signs can be very different depending on what part of the brain is affected.
Okay.
But the really important things to look for are, first of all, any weakness, and secondly, trouble with speech. So in fact, we tell people the three things to look for are: one, if there's a facial droop, if one side of the face is not acting right; two, if there's trouble speaking, have someone try to repeat something after you, and if the words are coming out wrong or they can't say it; and three, look at arms. Have someone hold up their arms, and if they're having trouble with one of the arms, that could be signs of a stroke.
I actually didn't know. I was getting a scan, and then they said, you need to get checked into the hospital because you're having a stroke. Kind of come a long way, and knowing that I'm better, you know, they've helped me get better. Well, he's pretty good about asking me my questions and knowing I'm getting better slowly. He said my answers are better than before. They helped me a lot.
If somebody has any stroke-related questions or neurology-related questions, how can they get in touch with you folks, or how can they learn more information?
They can call the call center at Castle Hospital, and depending on the question, they'll be put in touch with resources or be given a number they can call a specialist.
Dr. Viereck, thank you so much. We appreciate you being on Living808. It's so nice to know that they are really helping people, and it's good to know that you can go there and they're actually going to take care of you. And there's so many things that you can do to notice it. I have a friend that has suffered a stroke, and it's not so much preventable as it is. You can take care of yourself in a lot of ways. So.
And some people mistake some of those signs for something else, and there's a lot of resources if you do have a stroke for relearning certain things afterward, too. So go check it out. Thanks to our friends at Castle for having us.